This is section 9 in the discussion on the fourth generation photodynamic therapy. Another autoimmune disorder, diabetes. Now, for a long time they've said, oh, it was genetic. And now what they're saying is, no, actually it's an autoimmune disorder. Your body is attacking itself and it's killing the insulin manufacturing cells in the islet of Langerhans in the pancreas. And then you start having all of these problems. It's not a problem of high blood sugar. It's a problem of not enough blood sugar getting into the cells. And it also reduces the ability to circulate. So consequently, eventually the patient has to have dialysis. And then they start cutting off fingers and toes that have lost the ability to circulate. So because we were having success with autoimmune disorders, we didn't start out to look at diabetes, but what we found was that a number of our patients that we treated for cancer were also diabetic, an abnormally high percentage, about 13% were diabetic. In the normal population, it should be a much lower percentage. So what's the relationship between diabetes and cancer? Well, diabetes doesn't cause cancer. Cancer doesn't cause diabetes, but there's a drug that they use to control diabetes called metformin. It's actually carcinogenic. If you take metformin long enough, you'll probably get cancer. At least your odds on cancer will increase dramatically. So we decided, because we were seeing these patients with diabetes, one of them commented that their blood sugar had leveled off and they'd stopped taking their insulin. So for several years, we started measuring the blood sugar on patients before we treated them and following them afterwards. And then eventually we said, well, we can treat this as a standalone disease, just like we treat multiple sclerosis. All we have to do is put the sensitizer in at a slow rate, scan over the body slowly, and what happens is, okay, before treatment, this is the blood sugar level. All right, and this is the medication they were taking to try to control it. It was still on medication here, and it was way up into the red danger zones. We stopped the medication after we treated him. He spiked up for about 1 day, or halfway through the day it measured high, and the next morning it was down to low, and it continued to stay low. No more medication. The red line down here is the medication. We stopped the medication completely, and his blood sugar went to normal. What's fascinating is it's not just the blood sugar. All sorts of things change. His energy level changed. His ability to have sex changed. His weight changed. Everything about his life in general changed. He became happier, more productive, and stronger, more fit. He was constantly wanting to race me on foot when we were going up and down stairs, and I couldn't keep up with him anymore. So treating diabetes is more than controlling blood sugar. It affects a variety of things. If you don't want to go for photodynamic therapy to treat it, I can tell you there are a number of natural remedies that you can take that will actually control this, as well as metformin, and eventually help the body to regain control of it completely. And they're less expensive, and they're far safer. The other advantage is healing. This is what happens when you have diabetes. The wound here was on a neighbor. I asked him what he did to his leg, and he said, I don't know, I forgot. And I said, what do you mean you forgot? It looks like it was painful. He said, yeah, but it was several weeks ago. I said, geez, why hasn't it healed up? And he said, oh, well, I'm diabetic. I don't heal very well. And I said, well, look, you're in the tropics. This is going to get an infection, and you're going to either be on very strong antibiotics, or you may actually lose that leg if you're diabetic. So we sprayed some sensitizer on it from the outside, hit it with a laser, and this is what it looked like a couple of days later. After 4 weeks of looking like this constantly, 1 small dose of PDT, normal scar tissue, complete recovery. In the next section, we'll discuss bacteria.